I am going to explain the reaction occurring when a client has a positive tuberculosis test. First, the client is injected into the forearm intradermally with 0.1 milliliters of a TB protein derivative. The PPD, purified protein derivative reaction, exploits the delayed type hypersensitivity reaction of a patient previously infected with TB. If an individual has previously been exposed to TB, the T cell will recognize the TB protein. Dendritic cells in the dermis layer recognize the PPD antigen and phagocytose it, then present it via MHC2 and travel to the lymph node. The TB protein is picked up by the macrophage and presents to the T cell. MHC molecules travel to the lymph system and then into local mediastinal lymph nodes where they will activate T helper cells. Hypersensitivity 4 reactions are cell-mediated and occur through either T cytotoxic or T helper cells. However, since the protein is injected into the dermis, there is no cytotoxic response. Subsequently, T helper cells produce cytokines that recruit more phagocytic cells. Th1 and Th17 cells produce cytokines such as GM-CSF, TNF-beta, and interferon gamma that recruit macrophages through specific receptors such as interferon gamma receptors. The GM-CSF cytokine activates macrophages to inhibit the intracellular growth of TB gamma interferon, which is a key cytokine that leads to inhibition and killing of TB. TNF-beta is a pro-inflammatory cytokine. The T helper cells continue to recruit macrophages and produce cytokines. This results in an increase in cells within the dermis. The intradermal layer begins to swell up with immune cells. A firm bubble will form on the surface of the forearm. This is referred to as induration, caused by the pro-inflammatory cytokines, interferon gamma, and TNF-beta. For patients who have not been previously exposed to TB, after injection, within the first 48 hours, the bubble will flatten.